Hello, I'm Dr. Stan Hibbs, a psychologist in Atlanta. I'd like to talk to you for just a moment about obsessive-compulsive disorder, or OCD. OCD is one of the most baffling conditions we've ever discovered. It used to be thought to be very rare, but we now know it's a lot more common. We now think that about 2% of the American population suffers from this disorder. An obsession is an unwanted, recurring thought, image, doubt, or urge that creates tremendous anxiety, distress, or disgust. A compulsion is a repetitive, ritualized behavior which is a vain attempt to lower that anxiety. The compulsion can be something overt, such as washing hands, checking door locks, or rearranging one's items. Or it can be covert, such as overanalyzing a thought or trying to neutralize a thought with a positive thought. It might involve seeking reassurance from others or doing online research on the internet. Each case of OCD is different, but OCD tends to cluster around several different themes. One theme is contamination. These are people who are deathly afraid of germs, viruses, toxic substances, whatever, and they're terribly afraid that these things might get on them and do terrible damage. So they avoid contact with these things as much as possible, and if they do have contact with them, they engage in excessive washing, showering, laundering, etc. The second variety of OCD involves fear that we're doing some harm or some harm will befall some person or persons because we weren't careful enough, because we weren't diligent. So maybe we left the door unlocked, and maybe we left the appliances plugged in or turned on. So this leads to excessive checking. The third type of OCD involves over-concern with order, numbers, or symmetry. Things have to be done in exactly the same order. We can only do things in certain numbers. We can do 3s and 7s, but maybe not 6s and 13s. Or symmetry, if we touch something with the left hand, we feel like we have to touch it with the right. There are two other kinds of OCD I'll talk about in future videos. One is bad thoughts OCD and relationship OCD. There are two things that we know that help OCD. One is medication. We know that certain antidepressant medications such as Prozac, Luvox, Lexapro, and others can be helpful. However, medication alone is rarely enough. Fortunately, there are now very good psychological treatments that help do quite a bit of good for OCD. The treatment of choice is a variety of cognitive behavioral therapy called exposure and response prevention, or ERP. In ERP, we help the client confront those situations that trigger the obsession and then coach them to resist the urge to engage in the compulsion. It's very tough work, but it's well worth it. Sadly, many people with OCD are so ashamed and embarrassed by their symptoms, they don't seek treatment. This is such a waste because treatment really does work these days. However, you do need to see someone who is knowledgeable about the conditions because many therapists aren't. A good resource is the website of the International OCD Foundation. So if you or a loved one is struggling with OCD, I urge you to seek help. Thanks for watching. If you have questions, my contact information is on the screen.